PADI Open Water to Advanced Diver Certification. All you need to know. Question 1. What happens to the pressure of air as a diver descends in the ocean? It decreases. It increases. It stays the same. It disappears. Water pressure increases with depth. Every 10 meters, 33 feet, adds 1 atmosphere of pressure. Question 2. An object that is neutrally buoyant will sink to the bottom, float on the surface, stay at its current depth, expand. Neutral buoyancy means the object neither sinks nor floats. Question 3. According to Boyle's law, if you double the pressure on a gas, its volume will double, stay the same, be reduced by half, triple. Boyle's law states that volume is inversely proportional to pressure, P1V1 equals P2V2. Question 4. What is the most important rule in scuba diving? Never dive alone. Always wear a wetsuit. Never hold your breath. Breathe as fast as possible. Holding your breath while ascending can cause lung overexpansion injuries. Question 5. How many times faster does sound travel underwater compared to air? 2 times, 4 times, 10 times. It is slower. Sound travels about 4 times faster in water, making it hard to determine the direction of the source. Question 6. Which color is the first to be absorbed, disappear, as you go deeper? Blue, green, yellow, red. Red light has the longest wavelength and lowest energy, so it is absorbed first. Question 7. What is decompression sickness, DCS, caused by? Oxygen poisoning, nitrogen bubbles forming in tissues, carbon dioxide buildup, hypothermia. DCS, the bends, occurs when dissolved nitrogen comes out of solution too quickly during ascent. Question 8. A safety stop is typically performed at what depth and for how long? 5 meters, 15 feet, for 3 minutes, 10 meters, 33 feet, for 1 minute, surface for 5 minutes, 20 meters, 66 feet, for 10 minutes. A safety stop allows extra time for nitrogen to off-gas safely. Question 9. The term nitrox usually refers to a gas mix with more than regular air. Nitrogen, oxygen, helium, argon. Enriched air nitrox, EANX, has a higher oxygen percentage, typically 32% or 36%, to extend bottom time. Question 10. What should you do if you lose contact with your buddy underwater? Search for 1 minute, then surface. Wait at the bottom for them. Panic and swim to the surface immediately. Keep diving. The standard procedure is to search for 1 minute and then perform a controlled ascent. Question 11. In the ABC pre-dive check, B stands for breathing, buoyancy, BCD, buddy, bubbles. The PADI pre-dive check acronym BRIF stands for BCD, weight, releases, air, and final OK. Question 12. Which part of the body is affected by squeeze during descent? Lungs, ears and sinuses, muscles, skin. Air spaces like ears and sinuses must be equalized to prevent painful squeezes. Question 13. What is the primary way a diver equalizes their ears? Swallowing, pinching the nose and blowing gently, yawning, all of the above. Various methods can be used to open the eustachian tubes for equalization. Question 14. The maximum depth for a PADI open water diver is typically 12 meters, 40 feet, 18 meters, 60 feet, 30 meters, 100 feet, 40 meters, 130 feet. Standard training limit for OWD is 18 m, AOWD is 30 m. Question 15. What are the signs of nitrogen narcosis? Feeling drunk or euphoric. Severe pain in joints. Extreme cold. Bloody nose. Nitrogen narcosis, rapture of the deep, causes an intoxicating effect at depth. Question 16. If a diver is shivering uncontrollably, they should keep diving to warm up, end the dive and exit the water, swim faster, take off their hood. Uncontrollable shivering is a sign of hypothermia. The diver must exit and get warm. Question 17. Which dive flag is red with a white diagonal stripe? Alpha flag, diver's down flag, storm flag, rescue flag. The red and white flag is the international diver down flag used in the US. Question 18. What is a thermocline? A device to measure depth. A sudden change in water temperature. A type of diving knot. A gas mixture. Thermoclines are layers where water temperature drops significantly. Question 19. To help a diver with suspected DCS, you should provide a warm shower, 100% emergency oxygen, a glass of milk, a painkiller. Emergency oxygen helps flush nitrogen and improve tissue oxygenation. Question 20. At 30 meters, 99 feet of seawater, the total pressure is 1 atm, 2 atm, 3 atm, 4 atm. 1 atm, surface, plus 3 atm, 30 m depth, equals 4 atm absolute.